Okay, I think we're going to start now. So hi everyone, thank you so much for joining us today for our workshop. Before we begin, I just wanted to briefly introduce myself and VOCO. For those of you who have been to our previous workshops, you've probably already heard this, but my name is Carly and I'm currently a junior in high school and a vocal student at the Juilliard Pre-College. My mission for VOCO was to be able to take current scientific knowledge and research in vocology and turn it into workshops that are practical and applicable for singers, so that they can take advantage of their voices and learn about it in a way that will be beneficial for them. In today's workshop, we will be covering what the SOVT is, SOVT physiology, voice consonants, and voice habilitation exercises. Teaching our workshop today is Dr. Dargin and Dr. White. Dr. Dargin has a doctorate in speech-language pathology and has a concentration on voice and voice disorders. And Dr. White received her doctoral degree in voice from the University of Kansas and enjoys an active teaching and performing career as a soprano. All right, so now I'm just going to pass it on to Dr. Dargin to start the workshop.
Welcome. Thanks for having me. I'm going to rename myself here. And it's nice to see you. So Carly told me about this awesome club for vocology, and I am one of the researchers in this area. And I said to her, how in the world did you even know what vocology was? And her comment was that she created this group due to COVID to learn about vocal health, which I think is really cool. So I see other people are adding in too. It's really nice to see all of you here. And it looks like most of you are younger, maybe in high school still. Is that true? Okay, great. What level are you in? Freshman, junior, senior? You can type it in the chat box if you want, or just unmute yourself. It's fine too. If you care to share, you don't have to share. So as you're chatting, so we've got a junior. Eloise is a junior and Benjamin is a junior. Where are you two from? New York area? No? I'm curious to know.
I'm from Pennsylvania.
Pennsylvania. Where in Pennsylvania, Eloise?
South PA, south of Philly.
Oh, nice. Okay. Okay, great.
With Carly.
Well, I don't want to take up too much more of your time, but on this stuff, I'm going to put in my email. I'm associated with several universities. There's my personal email that's associated with Visions in Voice, which is my website, where I do seminars on vocal health. For those of you who, I'm a professor, so I love to help students find their path and their career. So if at any time I can help you, or any questions, please let me know. And so now we begin. My dog is, welcome to Zoomland. She is squeaking on a squeaky toy. All right, so here we begin with I think I will tell you straight up how this is going. I'm the researcher. I'm also a performer, but I'm more of the research end. So I'm going to give you a talk on the research aspect. Don't leave if it's boring, because more fun comes after me, which is Dr. White, who is a singer. And so she will be able to enlighten you with more practical exercises. Archie, can you mute yourself, please? I've got a lot of feedback. Thank you. All right, so here we go. And can I share my screen? So I want to talk to you about semi-occluded vocal tract exercises, which are exercises to help alleviate the voice. Semi-occluded, what does it mean? Semi means somewhat, and occluded means to shut off. So it means somewhat shut off. Vocal tract is everything above the level of the glottis, which is the space in between the vocal folds. So everything above basically the vocal folds to the level of the lips is your vocal tract. And a semi-occluded vocal tract exercises is simply changing the your shape of your vocal tract so that less air escapes and more back pressure is produced, so that that air has a back pressure towards the level of the vocal folds, then putting them in more of a kissing sensation. So it's very therapeutic. And you could do these exercises when you're feeling vocal fatigue, such as some of them are you can phonate through a straw. You can phonate through a straw and blow bubbles. You can do raspberries. If you ever did this as a child, is where you put your tongue between your lips and blow. Those are exercises that really help with the efficacy of phonation. So the purposes of my study was to compare phonatory behaviors before and after doing these exercises to see if there was an improvement made. And who was involved? We had 4 people. This was called preliminary data. We had 4 people, 3 working on their DMAs, which is a Doctorate of Music, and 1 soprano working on her master's. There was no history of voice disorders, and most of them had 10 years of classical training or more. Age was 23 to 33. Tenor 1 and Tenor 2 stated that they had already used some of the SOVTs, semi-occluded vocal tract exercises. So the design of the study was, we created an aerodynamic and an EGG, which is electroglottograph, which is where we put electrodes on each side of the larynx to get an electrical signal so that we can tell the percentage of the vocal folds closed and the vocal folds open at a certain time. So we did this first to get a baseline, and a baseline is where we can see where people are just without adding anything else, such as the semi-occluded vocal tract exercises. So we had them, we got the aerodynamic piece, which they just phonated through a pneumotachometer, which is something that we put on the face, and there's a seal, and so we get a number that puts out. And then the EGG, the signal, the electrical signal on the larynx, as I described. So we got that when they were just phonating, when they were just singing without semi-occluded vocal tract. That is the baseline. Then we did a nasoendoscopy. This is where we take a small tube down one side of the nair and take it all the way down your pharyngeal apparatus so that it holds on top of your vocal folds. And there's a camera there, and so we can see that. If you've ever been seen for reflux or some kind of voice issue and the doctor puts something in your nose, or maybe they do a rigid one where it goes directly in your mouth, and it's really hard to phonate because you can't move your lips. Those are endoscopies or stroboscopes. And this gives us a visual inspection at that level. And so we were looking at this while we got the baseline for the nasoendoscopy, the viewing, when they just did non-occluded singing. So we were viewing it while they were doing it. And then we had them do semi-occluded vocal tracts and also viewed the mechanism. And then we went back to the aerodynamic studio and we hooked them up again with the pneumotachometer and the electroglottographs to get those signals. We used a strobe system. We asked them to do sing E and all while doing the following. They sang through a straw. They did a lip buzz. They did a raspberry, which is the and a tongue rolled R. And all activities were performed a minimum of 3 times. And these are examples then of semi-occluded vocal tract exercises, or SOVTs. And these are things that you can do at home without hurting yourself and helping your phonation at the same time. How did we rate the findings? We had a visual perceptual rating performed by a modified version of a stroboscopy formed by Poberka in 1999, and we had 2 raters. Both speech-language pathologists, I'll define as SLPs, rate them. And so we actually marked each viewing that we saw, and then we came together as consensus to agree, and we had to agree. One had to fight for a certain number and explain why, and then the other had to either disagree or agree to the number. Here is that form. We see amplitude and mucosal wave. For the purposes of this lecture, they're kind of the same. The midline is 0, so that represents your vocal folds together, completely pressed together. And then if it was on 10, they would be completely wide apart. So you can see the shading, 8 and 10 is really dark, and then 2 and 4 is lighter shading. If we had a 10, that would mean that they were wobbly and out of sync and out of phase, and just too much space in between the vocal folds and the glottic space in between. Where 2 and 4 is too pressed, meaning we want to have a little more relaxation of the vocal folds. In a voice disorder, you might have a portion of the vocal fold, this being the left fold and this being the right fold, looking down, and you would shade the portion of that vocal fold that isn't vibrating. Obviously, these were performers who had no history of voice disorder, so no box was demarked. Supraglottic activity is what we also call the false fold space. And so the vocal folds are called true folds, and the false fold is that area above the vocal folds, right up here. And it's where basically the wall of our pharynx comes in and phonates. So you've heard about dual phonation. Some cultures can even sing in biphonation, where we get 2 tones coming in with 1 sound. And this is where they have learned to use their vocal folds to produce a sound and the false vocal folds. This is not something we do in this culture or this country. And so we're unaware of that and unable to utilize that without further training. But a lot of non-Western cultures even use that in certain rituals and singing. In the video strobe, this is a nice chart I made for each singer. We have amplitude and mucosal wave, anterior, posterior, and medial lateral constriction of the false folds, that area above the false folds. The key to this is that the traditional SLP would say that any kind of constriction of anything in the apparatus, the vocal apparatus that we're looking at, would need rehabilitation, meaning we need to make that person learn how to phonate better. But we now know with more research that singers produce those certain pitches by squeezing certain areas of that tube. It makes sense in a physics posture. So when we elongate the tube, we change the physical properties, and that changes the ring and the ping of the sound that we hear. The way one singer, an opera singer, is able to cut through an orchestra is to do just that. They align their vocal tract in such a way that they're matching the harmonics to those harmonics and formants that we won't talk about, but they're this element that basically matches up, and it boosts their acoustic signal. So this tenor was improved a lot. So I put in red the area where there's improvement, and teal green where we see a level of maybe some need of modification because there's some tension there. So 6 to 8 is the perfect number. 2 is a little tight. And so the takeaway of this is that this tenor had such a ringy, pingy sound. It was the perfect tenor sound. And when we had them do semi-occluded vocal tract, all of a sudden the vocal apparatus opened up, and we saw clearly some nice relaxed pharyngeal wall space and just really good technique. And as I said, for speaking, that's great. But in singing, we actually need to be a little more hyperfunctional than the normal phonation. That makes sense. Most opera singers, I think the last number I looked at, they spend about 20 minutes of high functional phonation. And they've overused their voice basically to give this sound. Whether it's a good technique or not, it's still at very high functioning levels. So they need to have more time for rest. This is why opera companies give their singers a day or 2 off in between each performance, versus a musical theater singer who is required to do 8 performances in a week and is very taxing. And that is another reason why we might see more voice damage with musical theater performers who are actively engaged in that kind of regimen versus opera. And so this is just an example of what I talked about. This was the squeeze that I talk about. Under here is the white fleshy vocal folds. These are the arytenoids on basically the back part of your neck area, and this is looking here. And so the arytenoids come together. The arytenoids are actually basically the bony substance that moves the vocal folds together, that fleshy thing. And so when you hear of neurological voice disorders, that's when there's something wrong neurologically that is causing the voice not to work right. What that means is neurologically, these arytenoids aren't moving. So we can get unilateral paralysis or bilateral paralysis, where both sides or one side is not moving to bring the vocal folds over to the phonation area. And then going on to tenor 2, we see improvement in the raspberry. And tenor 3, I'm sorry, actually semi-occluded lip is better for tenor 2. Raspberry was very difficult for this tenor. Tenor 3 seems to do better with lip, and then soprano 1 is doing really well with raspberry. We talk about all of these things. Laryngeal height adjustment means how elevated our larynx is. So in your voice studio, if you study voice, you might have had a teacher talk about a lowered larynx, and you don't want to hyperfunctional and lift that larynx up. Now, it depends on the style that you're doing. You certainly wouldn't want to belt with a lowered larynx. That would hurt yourself. And so some singing teachers are very stoic in that one technique is great for all styles, which is really, really not right. And it will lead you into vocal repair or need of vocal repair. I will say that starting with one technique and learning that technique to carry over into other styles could be a great way to go, such as learning really classically how to lower your larynx and how to open your pharyngeal wall for a nice open space. And then you can add other types of styles to your performance. And so then I want to move now to our aerodynamic and EGG study. We just looked at the visual. Here, this is where we asked them during the aerodynamics, we put them into the pneumotachometer, which I told you about, this mask where no air is escaping, and we're getting all the breathing information we need, the aerodynamic information. And this is just a protocol of what they went through. They had to take a deep breath and produce a sustained ah for as long as they could on a comfortable pitch and loudness for about 5 seconds. We repeated this 3 times just to make sure there were no mistakes. Voicing efficiency, then we asked them to produce a pa in a 5-syllable train, like pa, 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 pa. That's a 5-syllable train. And we got the EGG on both sides of the thyroid to get a number. There was no warm-up. And basically we wanted the raw data of what their voice was like without any warm-up. So we started early in the morning. We asked them not to speak as much as possible or warm up before they came to the studio. And then they sang ah and did the pa 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 protocols in the pneumotachometer aerodynamic piece. And this is what we had them do. We had them sing through a straw. So it's like we had them go into their warm-up room, and they sang through a straw for 5 minutes. And then we didn't even listen to them or gather any data. We had them come back, and then we took that protocol again, the singing as long as you can on an ah, and then the 5 pa 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 train. We gathered this information, the numbers that the pneumotachometer spit out. And then we said, okay, go back to the rehearsal room and now do lip buzz for 2 minutes and raspberries for 2 minutes. So we rotated back and forth. So the point of this was to see the immediate after effect. Was there immediate after effect after phonating through a straw in the output signal aerodynamically? Same thing with lip buzz, raspberry tongue rolled R. And then we ended with them singing an ah for 2 minutes in the practice room, and then we came back and had them do the ah and pa, 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 pa for a final comparison to the baseline. So note here, there are no specific instructions on the pitch or loudness. And as a singer, you will know that that makes a big difference. So if you think, though, as a non-performer, most people don't think about pitches. It's just comfort. So one of the downfalls to this research is you want to control as many variables as possible. And one of those controls is pitch and loudness. The problem with that is everybody has a different comfortable pitch and loudness. We all have different fundamental frequencies. So to make everybody sing on a certain pitch would then really, it could make them be more tense and would really not be effective for this research. And here are the diagrams. As you can see, the first bar represents the baseline without any SOVT. The last bar is the after effect of the non-occluded. The three in the middle are semi-occluded exercises. Give me one moment. So as you sit there, I would like to ask you all to just practice a semi-occluded vocal tract. So let's try a raspberry. Everyone try doing this. Right. Now do. So you're probably most familiar with that one. And I think that the take home to that is everybody has a certain type of warm-up that's best for them. And so to say everyone should do a tongue rolled R for 10 minutes before they sing, if that person doesn't roll their tongue well, they're going to be causing tension in their laryngeal apparatus. So here you can see that after the semi-occluded exercises, right here, each singer had an increased SPL value. So we might say that there was more power in the acoustic signal through an adjustment with the vocal tract and maybe better format tuning. The next slide is mean expiratory airflow. As you can see, we have an increase of the non-occluded sound after doing the SOVTs. You can see this is very low. This is suggestive of error, which is why I said we do them 3 times. This obviously is we call this an outlier, and we would eliminate that from our data. Here's the mean EGG percentage closed the vocal folds. This is very controversial, and there's not a lot of research. There's more research now done on this than before. But keep in mind that the data that we have is for normal speakers, not singers. There's not a lot on singers. Some people would say over 50% is hyperfunctional, meaning disastrous to your voice. However, there's been some research that shows that even up to 80 and 90% could be needed for good singing, meaning that 89% closed phase of the vocal folds. So let's take a moment and just talk about the vocal folds. So when I talk about phased close, it's what's the percentage of that movement that the vocal folds are closed versus at this position opening, because the vocal folds behave like this. This is their motion. And for children, they're doing that about 300 times a second. That's a lot. For women, you're doing that around 225 hertz, meaning 225 cycles per second. And we label that hertz. Men are around 125 hertz. Now, obviously, the higher pitch sound has the higher number. The lower pitch sound has the lower number. So bass baritones would be on the lower end of 100s, where the higher tenors would probably be higher end 100s. And so that has to do with the length it's a physics equation. The length of the vocal fold, women are usually 15 millimeters, and the men usually have 17 millimeters length of vocal folds. So the length has to do with the time to cycle. So it takes, if you have a shorter vocal fold, you do the cycles more per second than if they're longer. It takes you longer to get through a cycle if those vocal folds are longer. And that's how we get that pitch that we have. So if you watch CBS or some episode on TV and you hear this really deep bass, or you hear really deep bass singing, that person has a very long vocal fold compared to a tenor or compared to a soprano. So altos would have minutely longer vocal folds than sopranos, etc. And all right, so mean peak air pressure. This basically means average subglottic pressure. And what is subglottic? It's the area below the vocal folds. So your subglottic, your lungs, your capacity that way. The whole purpose of semi-occluded vocal tract is this. It's to decrease the subglottal pressure. And you can see that after the baseline to the post, after the semi-occluded vocal tract exercises, increases substantially or decreases substantially on all of them except tenor 1. And that you can see by looking at the strobe, though, that his production is very good. Mean airflow per voicing, an increase in the number is suggestive of incomplete glottic closure. So we want, we see the baseline lower than the final one after the SOVTs on every situation. And a decrease of numbers suggestive to pressed phonation. So we are basically doing less pressing here. That's the takeaway from that. And you can see these are outliers, right? So there was a mistake. We kept those out of our data. Aerodynamic resistance. All subjects fell within the normal range. We have a decrease in every one after SOVTs. You can see we took this out of the data, 10 or 3. There was something wrong with how we were our signal or pneumotachometer or something there. And soprano was a decrease as well. If the numbers increase beyond these ranges here, that's suggestive of excessive muscle activation or glottal resistance. Why is that important to voice? Because we want to be as least resistive as possible to produce the most glamorous, less effortful voice. Not so much for the sound, because, although it will produce beautiful sounds, but it's for the longevity of your career and your voice. If you are a voice performer, you're having to keep your instrument in tune at high levels compared to everyone else. And the very little things that you do add up to years onto your career as a performer. In conclusion, all subjects improved on at least one semi-occluded exercise on all the diameters that or variables that we looked at. All subjects improved on the aerodynamic on all subjects. And some limitations, it was a small sample size, it was preliminary data, and some limitations listed as there as well. And the research can be taken forward into the clientele that have hyperfunctional voice disorders, those who really hyperfunction their voice, meaning when they speak, they use the false folds to cover their true folds. They're hyperfunctioning, and that is a sign when you visually look that they have hyperfunctional voice disorders, and they're going to have voice fatigue all the time. Now, that is concluding my presentation here. The one thing I do want to say as a singer, actor, and now scientist and academic is that, and researcher, is that I hated as a singer to hear my voice teacher, especially as a young singer, say anything about my breathing. I was so tired of talking about breathing. I often just wanted to, and I did say, I was like, can we just sing and not worry about breath right now? Because I'm, I'm obviously never going to do it right. So there's some truth to that, in that we don't want to put so much emphasis on breathing all the time that we become super attuned to it, that we just get in our way. But at the same time, I teach myself that it truly does come down to breathing. As a clinician, I often, every voice problem I have, non-singer, probably singer as well, is related to breathing. So I always go back to the breathing. So please, as a singer, be good to your voice teachers and listen to them when they talk about breathing. And that's it. Next will be Dr. White to talk about probably a lot more fun things for you.
Well, thank you, Dr. Dargin, for the introduction, and thank you for the interesting research. So one of the things that I really enjoy doing is taking research like that and actually breaking it down and saying, okay, well, what can we do with this research that actually can positively affect our voice? I feel like research lately has gotten so much better, but not all the time. I am going to do as Dr. Dargin did. I'm going to drop my email address here in the chat box, just in case anybody has any questions that they're like too shy to ask after the fact. I'll be very happy to talk with you. As you know, anytime that I can. I also have to say that I see that Benjamin said that he is from San Antonio, Texas, which is so cool. I'm a native Texan, and I spent about 10 years of my life in San Antonio from age 3 to age 13, and I still love it there. My sister lives in New Braunfels, so I get to go, kind of in the area every so often, which is great. So today I'm going to be talking to you about SOVT exercises and kind of how we can make them practical in our singing lives. And I have had a rough voice week. I've not gotten a lot of sleep. My dog has been sick. And so please forgive if my voice is a little unsteady. I promise it's not because I don't practice what I preach. It's just because you do have to sleep occasionally in order to have a healthy voice. And I'm sure Dr. Dargin can back me up on that. So we are going to go into this. I just have to move the things so that I can actually get into my presenting here. So, all right. So now that you know what SOVT is and kind of how it works, I'm going to talk in a slightly different way about why you should use these exercises when you're practicing. You can even use them when you're not practicing. I'm basically going to give myself like a mini voice therapy session today in your presence, because that way you can see kind of what happens. I didn't intend to have my voice sounding like this today, but we'll take it. But let's talk about some of the benefits. And I'm also going to have a little bit of a anatomy and physiology lesson for you too. But I have cool 3D models, so I promise it'll be fun. All right, so there are many benefits besides just what Dr. Dargin's research has shown to doing SOVT exercises, and they are quite wonderful. But I have to say, with a caveat, you have to do them properly. And if you're missing some of these elements that I'm going to talk about here in a few slides, then you aren't going to be doing any good. You're unlikely to harm yourself, I feel like, with these, but you just won't be getting the maximum benefit. So I want to give you the information so you can have the maximum benefit. So one study, I have a quote here, says that using SOVT exercises produces a more economic voice production from the point of view of vocal fold tissue. So that's a beautiful thing. We want that all the time, because the more economy and efficiency that we can have with our singing, the longer we can sing, the longer we can go through rehearsals, performances, and have all kinds of stamina to make it through all of the tasks that our voice needs to do all day. It can be helpful for both overactive laryngeal muscles, so that's that hyperfunctional case that Dr. Dargin has been talking about, where you've got laryngeal muscles that are overactive and that shouldn't be helping quite so much. And it's also helpful for underactive laryngeal muscles. So this has even been used in like therapy, speech therapy, but therapy for patients who have hypofunctional laryngeal muscles, where they're having like even like a paresis, where one of the sides is not really behaving correctly and wanting to come together properly. So one of the benefits of these SOVT exercises is the back pressure that's created, and that back pressure really acts as an equalizer of pressures below the glottis, which is underneath the vocal folds and into the trachea, and then right above the glottis. So when you have that pressure equalized, it's much easier to do things like navigate through transition areas of your voice. Some people call them breaks, some people call them registers, whatever you want to say, whatever your teacher says that makes sense to you. It really, really can be helpful here. With that pressure equalized, the muscles can do all of the adjusting that they need to do, and without any sort of really obvious transition sounds, which is quite nice. It's what we are all working on, especially those of you who are in high school. I assume that is a big area of work for you, especially the ladies working from chest voice to head voice and back again. So much fun. A lot of my students happen to be high school students at the moment, and so I'm working on that all day, every day, pretty much. I love it, but it is not easy work, and you have to be pretty brave about it as well. And I know it's also similar for the gentlemen. So the other thing it does, because of the back pressure created with the occlusion at the level of the lips, it basically acts as a helper for every single motion that the vocal cords are doing. So whether they're coming together or they're going apart, it helps. So there's more positive pressure when they are going to go apart. And so it helps them to go apart with less effort, because that positive pressure is reinforcing that motion that's already happening. And then when the pressure is going down, you also have help for them closing, and so that they close with more ease. And this is again the entire point about the more economic production from the point of view of vocal fold tissue. So you also get this better TA-CT ratio, which means nothing to you right now. However, give me a moment and I'm going to make it mean something. So here we go. And I may have to do like a quick little switcheroo thing so that you can also see this screen. So here we go. Can everyone see a larynx? Wonderful. Okay, so, and Dr. Dargin was talking a little bit about this earlier, but now you can see it a little bit too. So here we have a larynx. This is not really what it looks like. This is cut away so we can see inside, right? And we have a thyroid cartilage here. We have a hyoid bone. We have a cricoid cartilage, and then here's the first tracheal cartilage as well, okay? So what we're really going to focus on talking about today is a couple of these muscles and a couple of these cartilages. So let's talk first. Actually, I'm going to take this. We're going to take away some of these muscles, and we're going to look at the arytenoid cartilages really quickly too. And forgive me, I never remember which direction to turn this thing, so it always ends up upside down, and I don't want it to be. So anyway, these little pyramid-shaped cartilages are the arytenoid cartilages, okay? And they are basically taking care of, as Dr. Dargin mentioned, they rotate inwards to close the vocal folds together, and outwards as well to abduct the vocal folds, meaning have them apart, okay? And most of the muscles, most of the intrinsic muscles of the larynx actually attach to the arytenoid cartilages. A lot of them do. And then, of course, they attach to either the thyroid cartilage or the cricoid cartilage, which is how they get their fancy names. So let me go back up here just a little bit. I think that's actually, I don't need the membranes today. So we will let the membranes be. So we're going to look first at, oh, I do need one more level because I don't have a cricothyroid. There we go. Okay. So we're going to look first at the cricothyroid muscle here. So this muscle actually moves the cricoid and the thyroid together towards each other, which ends up moving the vocal folds. Okay, so this is one of the muscles that we use when we're changing pitch. We use it when we're changing pitch when we're speaking. So if we get really excited and our pitch goes up here, your cricothyroid is helping with that pitch change. Okay. And let me show you, I've actually got a cool little, it's like a 1-second video, so I'll play it like 5 times. But you can see from different angles here, the cricothyroid muscle is going to work, and you can see its action. And then the blue on the inside, that's actually the vocal ligament, which is part of the vocal folds. So, see that action? Pretty cool. And so the other muscle that helps with pitch change is the thyroarytenoid. So, called so because it attaches to both the thyroid cartilage, which is the one that we can feel like out front here, right? And if you are a gentleman and have an Adam's apple, then you that's the front part of your thyroid cartilage. And the other place it attaches is the arytenoid cartilage, okay? So this one also helps change pitch, but it's doing so by altering the tension of the vocal fold itself, as opposed to just doing that stretchy motion with the big tilt that the cricothyroid muscle causes to happen. So when we're singing, we actually want to have a little bit more. Studies have shown that like more thyroarytenoid muscle activation is better for singing, for changing pitch. Let me just show you a little bit. So this shows you a little bit of what is happening here. So there's another muscle here, the lateral cricoarytenoid muscle is helping to adduct the vocal ligament, the vocal folds together. But this thyroarytenoid muscle running here, as you can see, is a big part of that control there as well. Now, let me just show you also for reference here really quickly. I need to see what I mean? It just goes all over the place. It's just upside down and everything else. This is the upside down that I want. So let me just show you your vocal ligament real quick. So this little guy right here is your vocal ligament. And this one above here is your vestibular ligament. So those are those false vocal folds that Dr. Dargin mentioned before. And here is your vocalis muscle right here. So the thyroarytenoids basically are just above the vocal folds, and they're just at the sides. They're like on the outside part, just barely, of the vocal folds themselves. So they're super close, good buddies. So I think that is everything I wanted to say about that part of it. So we're going to go back to we're going to go back to my slides now.
This is, while you're going back to the slides, this is a lab that I use called Primal Pictures when I teach. And just to throw a shout out, I'm developing a vocal health / vocology certificate at a university. So if that is something that interests anyone, it should be starting next fall. and you can email me for details if interested.
Good stuff. Good stuff. So now, some of this I already kind of said here. So the thyroarytenoid is increasing the rigidity of the vocal folds. This is especially true when we're singing or speaking at higher volumes. The cricothyroid is lengthening the vocal folds by tilting the thyroid cartilage. And we want both to be used, but we want the ratio to be more thyroarytenoid, a little bit less on the cricothyroid part of it. And after looking and seeing how big a movement the cricothyroid causes to happen in the throat, when you think about all of the movements that can happen there, we can maybe imagine why that might be. It's a much bigger movement causing a lot more things to happen, where the thyroarytenoid is like right there next to everybody and it's like not a big deal. And so that's part of the reason we want more of that thyroarytenoid involvement. And so, as we see here, a relatively higher TA muscle activity can lower the phonatory threshold so that you need less subglottic pressure to make sound. So anytime you can lower your phonatory threshold, it just means that you are able to make sound with less effort and kind of less muss and fuss. Now, can you just, by thinking, say, oh, I'm just gonna, okay, that's great to know. So now I'm just gonna make my thyroarytenoid work harder. Sure, I can do that. If anyone can raise their hand and say they can do that, I am super jealous. And I don't know that you're human, you might be a robot. So I'm gonna be suspicious of you, okay? Unfortunately, as those of us who do this voice thing and love this voice thing know, we can't just get in there and like manipulate everything and like be like, okay, now you move. Okay, now you move, right? That's not how it works. I wish all the time that was the case. No such luck. So instead, we use SOVT to help us with this because SOTV exercises have been proven to increase that thyroarytenoid involvement and keep that ratio at a much healthier, happier place. So since we can't like directly make it happen, this is a way that we can help make it happen. So we have lots and lots of options for SOVT exercises to use. And as Dr. Dargin's data showed you in his study, different things work better for different people. So if one of these things feels better to you, if you like it better, do it. If one of these things doesn't work for you, it's okay. You don't have to try to fit like a square peg into a round hole. Just say, maybe that's not for me at this time. Maybe it's not for me ever, but don't give up on SOVT exercises. Just find one that you like, okay? So let's talk about a couple of these. So straw phonation. Okay, show of hands. You can like unmute yourself. If you can use the little like hand thing. Who has used straw phonation in voice lessons or anywhere else thus far? Anybody? You can also use the chat box. I can open
Brittany
it up.
goes.
Okay. Anybody else?
Great. It looks like you needed to have us talk about SOVTs.
I guess so. Yeah, all right. So you guys, straw phonation is kind of like the bomb.com. And I know that I just like aged myself like even more by using that expression. I don't even care. So straw phonation is super great. Again, with the caveat that you need to do it with correct technique. Otherwise, it's not going to be as beneficial to you. Again, I don't think you can hurt yourself by doing it improperly. You're just not going to see all the goodness. Okay, I have some leftover plastic straws, and I'm using them as slowly as possible and reusing them as much as is hygienically appropriate. And then once I'm out of them, I'm going to get like a washable one that is like non-disposable, okay? I just want everyone to know, all right? So the instructions here is we're just going to make sound through the straw. Basically what we're doing by using a straw, we're making your vocal tract longer is part of what we're doing. And then because it's narrowed down so much, that's what causes the occlusion, okay? So the first thing you need is you need to have a good lip seal around the straw. You do not want air leaking out on the sides of your mouth, on the sides of the straw. However, you also don't want to have like excess lip tension. So we don't want to see this. Okay, it's way too much tension. You're gonna like kill the straw, okay? And we also don't want to see this though. I have all sorts of air coming out the sides of my face. The other really important thing to get the benefits of this, you can't have any nasal airflow, okay? So when you're first working with straw phonation, you may need to hold your nose closed while you're doing it, or if that's really uncomfortable for some reason, you can also just place a finger right here so that you can feel if you have any airflow coming through your nose. Does anybody happen to have straws around? I think we talked about maybe putting that on the flyer or something, but I don't remember. Anybody have straws handy? It's okay if you don't. Nobody's in trouble. Nobody's in trouble. It's good. It's good. Okay, so with the straw, we're just going to sing through the straw. One of the really important things, and I will say this with all of these SOVT exercises, it's really, really helpful and useful for your vocal tract to imagine that you are saying a vowel or about to say a vowel all the time that you are doing these exercises. Otherwise, what ends up happening is that we get this really kind of collapsed everything in here. So everything drops, and then all of a sudden everything has to like reopen back up when you start singing a vowel to that vowel shape. And it really, it's actually like more work. So you're, again, missing some of those benefits. So if I sing through my straw and I don't have that vowel imagination kind of thing going on at the same time, here's what I end up with. It's not terrible, right? It's like you can still hear, it's like still there's resonance there and everything else. That's great. I do feel a lot of vibration on my lips, and it sort of makes me, and like in my nose, even though I don't have air coming through my nose, sort of makes me like a little dizzy if I do that for a long time, to be honest. So instead, if I'm imagining that I have a vowel, so I'm gonna imagine that I have an ah vowel this time, for example. Can you tell that there's a marked difference in the quality of the sound there? Yeah. So it's a really important piece of this whole puzzle of using SOVT exercises in singing sort of things. Now, SLPs might not use that in speaking things. However, for singing, this is definitely something that you want to do. Now, we're not trying to have an equal volume to having an open mouth, right? With this kind of a thing. It will still be a resonant sound, so you're still going to feel buzzing different places and everything else, but you're not going to have the same kind of, aural feedback that you get when you're singing, a vowel. Okay, so don't expect that, and don't try and make that happen. Again, otherwise you're going to be not happy with this whole thing. Now, one of the things that you can do is you can play around with different vowels for that vowel idea, and you will get different sounds. So if I do this, can you hear that I sang a bunch of different vowels there? Part of what's happening there is my tongue is moving around. So this is the other really great thing about this. If you're using straw phonation, being able to have your tongue in like a different place, and every day your tongue is like maybe a slightly different degree of tense or lax, right? So you can pick a vowel shape that day that really supports your tongue being in a position that is comfortable for you that day. Does that make sense? I'm seeing some shaking heads. Yeah, good. Okay, so I'm going to like do some more demonstration of this later, and I have some things we can try together if people happen to have straws around. So I'm gonna actually, well, I could. Did anybody get a straw? Anybody have? Oh, okay, good. All right, so those of you with straws, those of you at home without straws or who don't have your cameras on, which is completely fine, feel free to do whatever you'd like to do. But if you want to, jot this down to try out later or something like that, I'm just going to do some lovely like slides on my, and then I'll leave a space for y'all to do that afterwards. You don't have to have your sound on, you can keep it off, but just give it a try and see what happens, okay? So we're doing the checks, right? We're gonna make sure that we have a good lip seal without a lot of lip tension. We're not gonna have any air coming through our nose, and we're gonna imagine a vowel. So pick your vowel, and here we go. So we'll just go. Try that on for size. Good. If you don't feel slightly ridiculous doing this, you're not doing it right. Okay, just so you know, that's the way this goes. Okay, most of these SOVT exercises are that way. If you don't feel slightly ridiculous doing this, you're not committed enough to doing it, I guess. So I want us to try a little something. This is a perceptual thing. So again, we're in sort of like murky scientific waters. However, it is a real thing. I'm more of a soprano, so I'm going to go kind of in the middle here. This may or may not be like the most comfortable spot for you. So if there's a more comfortable spot, you can try this on your own. But what I want you to try is we're going to imagine our vowel, and whatever vowel you imagine is the vowel you're going to immediately sing afterwards. So you're going to do a slide of a fifth up and down, and then you're going to do it on the straw first, and then you're going to take a breath and immediately sing it on the vowel and see how it feels, okay? So I'm going to go here. Oh. Give that a try. Whatever pitch you want. Good. Okay. So now I have a question for you. And you can shake heads yes and no, or shrug. Do you feel any difference in the ease of production of the vowel after having done that? I'm getting some like sort of head nods maybe, and I'm getting a couple of like real head nods. Yeah, good. Yeah, it's a real thing. And this is like not just me like making this up or trying to like put this as some like quick fix or anything like that. This is real. There are scientific data that over perception that this is definitely what people perceive after doing these. Now, you may not always perceive it on the very first one, and you're new with this straw phonation thing, but this is an option, okay? So after straw phonation, we also have other options of things to do with straws. You can also put your straw in water. So all of our same previous rules apply, just like they did before. So you gotta have the lips, not too much tension, enough tension. Not worried about volume. It's especially true with the glass of water. You can also do this with like a water bottle if you'd rather. And we don't want any nasal air happening either. So really important when you're using a straw in water, you want to make sure that the depth of the straw is not too much. You can create too much back pressure onto your vocal folds, and it will actually impede the progress as opposed to being helpful at all, okay? So it's best to start out with about an inch of water, and then you can kind of adjust it based on feel. Now, different days may be different depending on what's happening in your vocal world at the time. So this looks like this. And you probably can't even hear anything other than the bubbles. If I have my best guess, you may not even be able to hear the pitches on that side of things. However, I was doing another slide. Okay. And so what we want to look for here is we want to make sure that we still have this imagined vowel idea. Okay, that's super important. And the nice thing about this is you get really immediate feedback, not only from the feeling part of it, but also you can literally see the bubbles. So you can see if you have some like big giant airflow increase or decrease somewhere, as opposed to something that's pretty constant. You can check your, you can also check your onsets and offsets, right? So if, for example, I do this, so you should have seen a giant bubbles at my onset there. That means I'm using way more air than I need to. That's not a very, it's not the best of onsets, right? And you can also, if I go here, so I'm really far down into my glass of water here. I'm feeling quite a bit more back pressure. It actually doesn't feel that terrible today because my voice is not the happiest camper in the world. But on a healthy voice day, that would probably be more back pressure than I really want or need. Okay. So there's your quick overview of straw phonation. And straw phonation really is a terrific and wonderful thing. So I encourage you to really use it. I'm going to show you some of the ways you can use it in an actual practice session here in a moment. I'm going to move through some of these other ones just a little quicker. For the sake of time, I want to leave some time so that you guys can ask questions of myself and Dr. Dargin and everything else. So you can do lip trills. I'm assuming lip trills is probably something you're more familiar with. Would that be correct? You can like nod, yes. Yeah, okay. Lip trills are something that you probably, like if you're in a choral setting at some point in time, these get used in choral settings all the time, okay? Lip trills are kind of like the older sibling of the straw phonation, I feel like. They were super cool for a while, and then straw phonation sort of took over as something that was showing even better benefits for a lot of people. So you're phonating while your lips are vibrating against each other when you're doing this. Again, you don't want to have any nasal airflow. I don't know if you could even really sustain a lip trill with much nasal airflow at all, so that probably isn't something you're going to have to check for a lot. You need relatively relaxed lips and cheeks. I can say from teaching these in many, many lessons, you cannot lip trill and laugh at the same time, so, or smile. It's just, you know, even though it's more fun to do that. So again, you're going to imagine a vowel kind of behind the sounds that are coming out of your lips there, okay? So again, it's helping with not having everything in the vocal tract be really weighed down, and you end up with a better tongue position as well, okay? So if I'm gonna do some lip trills, you've probably done these before, but I can do them this way. My sound is rather forward and kind of pressed, and that's actually not going to be my healthiest version of a lip trill, okay? My healthiest version of lip trill has that vowel imagined behind it, so I'm gonna imagine, well, I'm not even gonna tell you what it is. So that's a much better coordination. It's a much healthier coordination. And my speaking voice actually feels better just from doing that little bit right now, which is kind of amazing, but that's the immediate effects of SOVT exercises. They're great that way. You don't even have to wait for the payoff. It's just there. So again, you're not going to have as marked a difference between the volume as you will when you're using a straw, because the occlusion is not as far away from you, so you get a little bit more oral feedback. Air management can be somewhat challenging with lip trills. So the best advice I can give for good lip trills is to be patient with yourself, be willing to take a short break and laugh about it for a second when it all blows up in your face, because you are going to have false starts, all that kind of stuff, all the time. It just happens. So, you know, don't worry about those and just keep going. And everything else. You also want a nice, easy onset. So again, this is the kind of going back to that same, when I showed you the onset of the straw in the water, when I had that really breathy onset. With lip trills, if you can have a calmer onset, it actually helps the whole trill go much, much easier. So I'll leave you, since you're more familiar with those, I'll leave you to kind of try some of those on your own, okay? For the sake of time. Then we have raspberries. And this is a variation of the lip trill. If you find yourself experiencing some tongue tension while doing lip trills, raspberries are a great alternative and a great idea. Not everyone loves these. In the time of COVID, do these by yourself in a room where you're not going to splatter, you know, everyone around you, okay? I don't usually, like, I will tell students to do these in practice. When I was having lessons in person, I don't usually do these unless we have a big room, just because it's kind of gross. So, but they're great. So, you're gonna do. Okay, and so, again, these are not my personal favorite, I wouldn't say, but they really can be great if you're experiencing some tongue tension. And yeah, I would say that air management is probably a little more difficult with these for some people. It does require slightly more airflow to keep them going than some of the other SOVT exercises. Sorry, my dog is. Are you okay, bud? Yeah, you're okay. All right. So then you can also use tongue trills. So tongue trills are going to be like basically a rolled R. We're going for like an Italianate sound. And these work for me some days and they don't work for me other days. So I'll try and demonstrate these, but I didn't learn how to roll my R's until I was about 26. And I'm not going to tell you how long ago that was. But I just couldn't roll my R's. And then I was in Italy studying abroad for a little while, worked with a coach over there who had great tricks for things, and he finally got me to roll my R's, which was great. Tension of the tongue will become immediately apparent if you try and do these. Because of the way that our speech system works, if you imagine that you have a vowel to say right after this, you will end up with that sort of, that vowel sort of like space in your pharynx, and it is super helpful for it, and you'll have a much easier time with these. So if you can get a nice thing, and you end up with again a really nice resonant rolled R. Let's see. And the nice thing about using a consonant that's an actual sound that you'll make, you actually come across these in your repertoire on occasion, especially if you're singing any Italianate repertoire, if you're singing Spanish, and you know, many other languages have rolled R's. English is one of the only ones that doesn't. And if you're doing British English, you do have to roll the R sometimes. So you can actually take this and take something out of your, repertoire and do this. So, and I have sung these sweet little Bellini songs before, and many of you probably have as well. Oh, except that it says, there we go. So if I do this, I have an R to roll in this very first little phrase that I have to sing, or it's like a sub-phrase. And so if I do it on a rolled R, and then I go back and sing, Quando verrà quel dì, I actually get to use exactly what I was just doing. And so it's a very handy sort of thing. That does happen to be a double R, so I can use that much R there, which is kind of fun. So those are really terrific. Other voice consonants that you can use You can use V as in the word voice. You can also use a voiced TH sound, like a th. So as in the word thine or these. Again, this is a really nice one if you struggle with tongue tension to use, because your tongue needs to be protruding from between your teeth just a little bit in order to correctly produce this sound. And then you can do z, z as in zoo. That one is a little tricky and probably not as helpful in your upper registers because you are going to end up probably with some jaw tension, or that's pretty likely. So I would be careful about using that one, throughout your entire range. The rest of these you can use throughout your entire vocal range without any worry about any sort of damage or anything like that at all. So again, with these, you want to remember all of the other directions about imagining that there's a vowel paired with the consonant. You want to make sure that there's no nasal airflow present because these are not nasal consonants. And then be aware of articulator tension. So, just pay attention to what's going on with your lips, your tongue, and your jaw while you're doing these things. And if one of those things is starting to tighten up, maybe switch things up. Or if you have other strategies for addressing that tension that your teacher has taught you, it's a wonderful thing. And the airflow is going to be different for all of them. So you have to kind of get used to what the airflow feels like for that particular voiced consonant. Okay. And again, just to reiterate, not everything is going to work for everybody. And even something like, let's say TH worked great for you yesterday, and you come in today and it may not work for you quite as well. That's okay. There's nothing wrong with you. There's nothing wrong with the exercise. Your vocal tract today is different than it was yesterday because you slept differently, you ate something different, and maybe you had a touch of reflux, God forbid. Or you slept funny last night and your jaw is a little bit more tense than it was the day before, or you had, twice as much speaking to do today as you did yesterday. So it's just sort of the facts. When you have, voice as your instrument, we have to deal with a changing instrument every single day, which is sometimes fun and sometimes not a whole lot of fun. So how can we use this in practicing? So if we're going to warm up using an SOVT exercise, we're looking for easy vocal production. It should always feel easy. If it's not feeling easy, try something else, or try it in a different part of your range or something like that and find the ease. But it should always, always feel easy. So they make a great first warm up because, again, you're setting up great pressure conditions and great equalizing of pressure and everything else for range transitions, for just subglottic pressure and everything else. So they're great. So I love slides and glides, if you can't tell, since that's most of what I've demonstrated, because they're so wonderful and you get to cover everything, every single half step, and even, semitones and such things you get to cover. You can also use them in scales. You can use them in octave leaps. You can use them in arpeggios. And one of my favorite things to do as an instructor is to start with an SOVT and then repeat it immediately on a vowel or with a word. So I'm trying to think what I was having people do today. Oh, I think I taught like 5 lessons before this today. So I'm very much in teacher mode today. And so, and what you want to do is you want to use the SOVT exercise as kind of a blueprint for what you're going to do with the vowel. So imagining similar airflow, all of that kind of stuff. Even though it's not going to be exactly the same, just that imagination is super duper helpful. And so in your literature and your repertoire, you can use SOVT to give you sort of a sensory blueprint for the amount of pressure that you need for that phrase or for certain notes in the phrase. And you can also use it to improve your phrasing and your breath management. So any of you who have used lip trills before in your warm-ups and things, you will know that they will tell on you if your breath management is not what it ought to be for that phrase. Or if you have a place where you're like losing a whole bunch of air that you didn't realize, or stopping your air in a place that you shouldn't be because it's a phrase. Once you start a phrase, the air just goes, right? Until it's time to take another breath. So lip trills will tell on you with this, because they will show like the air will just stop moving and you'll just be like, oh, well, isn't that interesting? Okay. So I definitely encourage those especially for the phrasing and the breath management. But the other, like the rolled R, will absolutely do the same thing. If you're using your straw in water, it will also tell on you. It is definitely a big tattletale. And any of the other consonants will tell on you. The straw by itself won't tell on you quite as much. You'll be able to feel it, but it's not going to give, like if you're doing this for your teacher or something like that, your teacher's not going to necessarily be able to immediately tell that, hey, the sound stopped and the air stopped for a split second there, or something like that. Okay. So, and as I said before, if you have a consonant that occurs in your song often, and it's one that you can use as an SOVT, go for it. Use that and get used to what that feels like to have that be a resonant part of your phrasing too. You can also begin a phrase with an SOVT and then transition into something else. So if I go back to my example of my sweet little Bellini song again, I'm just getting my pitch. So if I do this with a straw, I can go, so you can see I can use that and I can transition in and out of that. And you can do the same thing with the others. Lip trills are a little harder probably to transition in and out of speaking with, but straws and a lot of the consonants work extremely well for that. Let's see. Yeah, and I say here, straw and water, lip trills, and tongue trills are particularly good for aiding in breath management. And then, sorry, I'm having to move your faces so I can make sure I'm saying what I should say. So there haven't been just a ton of studies about cool down for singers in particular, but it does seem to be helpful. And I think that there's enough evidence that we can say it's worth the like 3 minutes to do a cool down after you've been talking a bunch or singing a bunch for the day. So before COVID, I used to teach as an adjunct at a couple of places, and I would sometimes have like 4 to 5 hours worth of lecture classes to teach. And they were just straight lecture classes. Like it wasn't, I tried to include participation in things and do things to engage people, but they really were just straight lecture classes. And so I had to speak for that long, and then I would have to go straight into teaching voice and piano lessons for another 5 to 6 hours that day. They were long days. And I started doing cool downs when I was doing that, and I saw a huge improvement in the quality and happiness of my voice when I started doing that. So I really do encourage you to do some cool down exercises. Again, straw exercises are wonderful for this, and other SOVT exercises if you don't happen to have a straw handy. And I literally used to have I always had extra straws in my car all the time, and I had different sizes too. So that's something I forgot to mention about the straws. You can use coffee stirrer straws. That's going to create more back pressure. You can use more than one straw if you need to not create quite so much back pressure. I have not tried the multiple straws, I will be honest, because one straw is usually just about right for me. You can also make your straw longer, and that will create a different level of back pressure as well. So you can really, sort of fine tune it to what feels good for you and what's a good option for you that day or on that piece of repertoire. So again, slides and glides are great for this. And gentle ascending and descending motions over a gradually smaller range. So you're sort of, getting back to that, stretching your voice out beyond where you might be using it a lot. So if you've just sung a bunch of high repertoire, it's really good to kind of get some descending motion back into that lower part of your register to make sure that those muscles get a little bit of like relief from having to have been suspended in a way. And if the opposite is true, then it's good to kind of get your high voice going again. Let's see. And then I just have some references here. So, and I will get with Carly and I can make these slides available to you if you're interested, just so you can have them for reference. I would like to point out this page right here, the Voice Science Works, is a wonderful resource. They have tons of information about acoustics for singers. They explain formants in really wonderful ways, and everything is science-based. There's some great videos on laryngeal massage there, which are it's a really wonderful thing to do. And they have a ton of ideas about how to do other kinds of like straw voice exercises, more about how it works if you're still curious, or if you need some more like visual, pictures of it, because everyone learns a little bit differently. So all of that to say, thank you so much for having us. And I'd love to answer any questions. And I'm sure Dr. Dargin would as well. So bring it on. Quiet group.
Tough crowd.
I know.
Not on stage. So I'll say that I'm very impressed with this group. I think you are contributing great things, and I think it's wonderful that you're able to connect and combine your passion and to further your education pursuits, whether that's in school or just at home, pursuing scholarly activities, whether that is research or performing. It's all scholarly activities. And so I commend you, and I look forward to seeing you in your careers in the future, whether that be on stage or in a scientific journal or a combination in our classrooms, possibly.
Yeah.
And I'm very intrigued to hear from you. Please feel free to reach out.
Yeah, agreed. If you have any questions about anything I've said, please feel free to send me an email, and I'll do my best to help steer you in the right direction.
Great. Carly?
Yeah, thank you again, everyone, for joining us. Like they said, if you had any questions, you can just email them, or you can email me and I can forward it to them if you want. Special thanks again to Dr. Dargin and Dr. White. Thank you so much for volunteering to teach our workshop today. Before we end, I just want to inform you all that I recorded the workshop and I will be posting it on our website for you guys to view if you guys wanted to. Also, this coming Tuesday, we will be having a workshop on principles of motor learning. And if you guys are interested and haven't signed up yet, you guys can shoot me an email at info@vocologyforsingers.com, or you can DM me on Instagram at vocologyforsingers. If you want to keep in the loop with more workshops, you can always visit our website or our Instagram page. Yeah, so if you guys don't have any other questions, we can end it here and have a wonderful evening.
Carly, who's doing the presentation on motor learning?
Dr. Bertolini Abbott.
Oh,
Kitty.
Yeah.
Oh, okay.
We know her.
Yeah.
Great. Yes, we're doing a seminar right now. She's presenting. I'm supposed to be organizing it, and I'm here. So I was going to say she is the expert on motor learning, and she's the expert in vocology. She, you reached out to her separately, or did I connect you with her?
I reached out to her separately.
Excellent. I'll tell her that we had a go at it before her, and she's wonderful. You absolutely must attend that seminar. You will miss
Yes.
the world if you do not attend. She is a rock star. And when I say the lead expert in the world, I mean it in voice. So she was a singer, knows Italian, she sang Italian, and she got involved in speech pathology and then turned into psychology and motor learning. And she is what we base resonant voice from. She is the creator of resonant voice, which is basically and the hum and the that real resonant sound. So
and she and Dr. Titsa actually came up